All right, hi everyone. This is Lola Nedich. I'm the coordinator of the Harvard and Beth Israel Deaconess Medical Center site for the New England Technology Transfer Center, Mental Health Technology Transfer Center. Please feel free to introduce yourself in the chat box if you'd like. And now, before we get started, I just want to review a few housekeeping items. Next slide, please. Participant microphones have been muted at entry. If you have questions during the event, please use the chat and you can unmute your microphones during the discussion portion. This session is being recorded and it will be emailed out to all participants once it becomes available on the website. If you have questions after the session, please email newengland@mhttcnetwork.org. At the end of the month, we send out certificates of completion for any webinars that you attended this month, so you can use those to submit to your particular board for continuing education credit. If you have any more questions about CEs after the event, please contact ifisher@c4innovates.com. Next slide, please. These are some MHTTC acknowledgements. Next slide, please. The MHTTC network uses affirming, respectful, and recovery-oriented language in all activities. That language is strengths-based and hopeful, inclusive and accepting of diverse cultures, genders, perspectives, and experiences, healing-centered and trauma-responsive, inviting to individuals participating in their own journeys, person-first and free of labels, non-judgmental and avoiding assumptions, respectful, clear, and understandable, and lastly, consistent with our actions, policies, and products. And with that, I will hand it over to Kelsey for some introductions.
Great. Yeah, thank you, Lola. And yes, please do continue introducing yourselves in the chat. It's always great to see where folks are coming from today. So I'm Kelsey Johnson. I am the program manager for MapNet, which is our psychosis network here in Massachusetts, where we've been talking a lot about ways to support employment and education for the young people in our psychosis programs. So really glad to have Debbie today. So by way of a quick introduction, Debbie Nicolellis is the training director at the University of Massachusetts Chan Medical School, transitions to Adulthood Center for research. So she has an interest and background in supporting people with mental health conditions to succeed in work and school and to have productive and meaningful careers. Debbie has a master's in Rehabilitation Counseling with a focus on supported employment and psychiatric rehabilitation from Boston University, and is also certified nationally as a rehabilitation counselor. But I think most importantly and most relevant to this talk, Debbie has been very involved in this HYPE model for employment and education support. So I will pass it over to you to kind of get us started on this topic.
Okay, thank you. Thank you so much. And I really appreciate the language guidelines for MHTTC. Thank you for that nice welcome. Hi, everybody. I appreciate your being here on the Friday before Memorial Day. Thank you for coming and hanging out with us as we talk about helping youth on the path to employment. And in particular, preventing long-term disability in youth and young adults through this very specified career development model. I also have some acknowledgements, and this might help me also to kind of introduce where I am, where I'm from, in a sense. I work with the Transitions to Adulthood Center for Research at UMass Chan Medical Center. Used to be known as UMass Medical Center, so you might know it that way. And the Transitions to Adulthood Center for Research, if you don't know it, really focuses on transition age young adults and youth, ages 14 to 30, with serious mental health conditions. And we use research and knowledge translation training in partnership with this population to support them to be in the kinds of roles that they want to be in. And that really ties in well with what we're going to be talking about today. A lot of this presentation was developed under NIDLR grants, the National National Institute on Disability, Independent Living and Rehabilitation Research. Let me talk. I didn't realize actually when I developed these slides that I would be introduced. So thank you for that. You've heard a lot of this already. I go by she, her, hers pronouns. And I feel like I've been lucky in my life to really focus in on the kinds of roles and activities that young adults and older adults really want to be in. I feel like I've been able to, I've sort of been lucky to hang out in the area of mental health that is very life affirming and fun. At least it's fun for me. I haven't lost my spark for this. I almost choked on this when I wrote this down on this slide, 35 years in the field. I did the math and I'm aging myself here, but in my time in the field, I have kept up a real love for this. Most of my career, I have been focusing on career development, valued roles, in particular employment and education for older adults. I take a little bit umbrage at that term, but older adults and young adults with serious mental health conditions. This is really important to me in my role as training director for HYPE and at Transitions ACR. And I'm really looking forward to talking with you all about it. I'll mention that I am representing a team of folks here today, including Michelle Mullen, who is the HYPE clinical director and the PI on our projects, Marianne Davis, who is the director of the Transitions ACR and ISPARC, which stands for the Implementation Science and Practice Advances Research Center at UMass Chan Medical School. And our research team. And I'll say there are folks who helped develop HYPE, of course, that I'm also representing here. This is our current team. As I get into what we'll cover today, I just want to say I really appreciate your introducing yourselves in the chat, and to please go ahead and ask any questions or make any comments that we can attend to. I really appreciate Kelsey for kind of keeping an eye on the chat and helping me to attend to questions that come up. We can attend to them throughout the presentation, and I'll definitely leave some time at the end so that we can go over questions that you have. If we don't have enough time to cover all the questions, we'll make sure that you have contact information so that you can contact me directly. Kelsey, were you going to add something there?
Nope, that covers it.
Okay, good. All right, so this is what I'm hoping to cover today. We're going to be talking about what HYPE is and how it developed. So a short history of HYPE, how we got here, what's at the foundation of HYPE, our foundations, what inspires us, kind of what guides us, and the research that backs it up. We'll be talking about how HYPE works to prevent long-term disability in youth and young adults, and then talk about how is it a specified model. It's a pretty complex model, and you'll get introduced to like what that is and what that looks like, including its executive functioning focus. I'll leave a little time at the end to talk about what we're doing now, and directions that we're headed in, and of course leave some time for Q&A. Okay, so let's get into it then. If you came today, the topic of employment for young adults that you serve is important to you. So I want to start by talking about what the heck is HYPE. HYPE stands for Helping Youth on the Path to Employment. And it is a comprehensive and very intentional service model that focuses on the career development of youth and young adults really, ages 18 to 30. Most of the time, there's a little wiggle room around that 18 and around that 30. But for young adults who are living with mental health conditions, we know that young adults in that age group, mental health conditions or not, want to be out doing the things that their peers are doing. And in my way of thinking about HYPE, it brings together the best of supported employment and supported education to help young adults maximize their capacity for success in career environments. So we are very much intentionally focused on supporting the success of young adults in those career environments. And I'm going to talk today about how we do that. All right, so if we don't have any questions yet, I'll go into the history a little bit of how we got here and like, where did it come from? So HYPE has actually been around for a long time. And one of the things that we feel kind of strongly about and a bit proud of is that HYPE is immensely based both in practice and in research. It did not just come from a research study that said we should do this, and it didn't just come from practice where we said this really needs to happen. It really came from both. Michelle Mullen began to look at HYPE, what was the predecessor of HYPE, in her work in college settings, looking at what college students needed from supported education kinds of services, and developed a program that still exists today called Learning Enhancement and Resource Network in New Jersey. That started in 2008. Somehow I'm going to 1998. I don't think it's that old. And that really looked to integrate supported education into existing supported employment services. So I'm hoping that people know those two terms, but supported education is a practice. SAMHSA has a toolkit for it in their evidence-based practice area that really is another specified model that HYPE is very well steeped in, helping people to choose, get, keep the kinds of educational environments that they want to be in, and really supporting success there. And similarly, supported employment has existed since the kind of 1980s in mental health, only since the 1980s in mental health. A lot of supported employment programs don't also have educational support built in. And so in New Jersey, they were looking to build in supported education into existing supported employment services. They got a randomized controlled trial to study Learn in 2008, and then were funded in 2011, 2012 to start to refine this model for young adults. And it culminated in the development and pilot of a HYPE manual and the development of an executive functioning curriculum that I will be talking about later. HYPE was developed both through research and practice, and had heavy it was heavily informed by both young adults and national experts from the field. So the PAC was our Participatory Action Committee. We are very interested in and very involved in participatory action, which is really having the end users of a product or something that's being researched be the researchers also of that thing. So we engaged young adults very early on in the development of HYPE. They and a national group of advisors came together, studied the literature, really talked to people about what would be helpful. And that culminated in the development meeting, consensus conference, which is pretty cool. I'm going to show you in the next slide. We have a pamphlet that really talks about what came out of that. But one of the things that I really love about this consensus conference is that an equal number of young adults with mental health conditions And researchers and national experts in the field came together to talk about what was needed. So that everybody had an equal voice as much as possible, an equal voice, and to really inform how HYPE would be developed. This resulted in a HYPE manual, as I said, and a community of practice. So this was super important. We still quote what young adults said in that consensus conference today, and really use a lot of what was talked about in that meeting to guide our practice today. Here's that pamphlet that I was talking about. Innovative practices to support careers of young adults with mental health conditions is available online on our website. I can send a link to you, Kelsey, if that would be helpful. So as I was mentioning, we had very early on involved young adults in big ways. And we still involve them in big ways, in two major ways that I can think about. Young adult advisory boards are very important to us. Some of our projects, we use at least two young adult advisory boards. There's one at the Transitions ACR, who really look at all of our research and products and give us their input and editing and thoughts. Sometimes beginning thoughts, what should this be? And they tell us what it should be. And sometimes we will add another advisory board, such as a research project that we had last year. We had a local young adult advisory board guide our activities there as well. And another thing that's really important to us, and I would say this is true at the Transitions ACR, as well as in HYPE, is that we hire young adults with lived experience so that they can further inform what we are doing every step of the way. So young adults were very much involved with the development of HYPE. And here's what we've been doing since. We have further research on FAST, which is our executive functioning curriculum. And they have shown great effect. I'm going to talk about that in a little while, on persistence in school for students with mental health conditions. This is a huge problem. Lots and lots and lots of young adults in college, for example, really struggle, white knuckle it through school, and may leave school and struggle to come back to school. So we have found, and we're delighted to have found, that our executive functioning curriculum has actually had a great effect on helping young adult college students stay in school. So I'll talk with you a little bit about that. Last year, we finished up our HYPE on Campus trial. It's the first time that HYPE was used outside of the community mental health setting. Usually we're training providers and systems and programs in how to provide HYPE from the community setting, and then supporting young adults wherever they're going to work and school. This was the first time we brought HYPE to a college setting and did a randomized control trial. We're in data analysis right now. So we hope to be able to share soon what came out of that. But what we did was train graduate students to offer this complex intervention to young adult college students with severe mental health conditions on a large campus, and supported them as they provided supports right on campus. And they were also peer-ish, sort of peers, because they were also in school, and so they had a lot in common. And we were really testing out, could this be done on campus, and could this be done with graduate students? These graduate students were social work graduate students. And then we have a study right now. As you can hear, we have a large educational focus in HYPE. And one of the things that we're looking at right now is the development of, the testing of, and a study of the executive functioning curriculum for young adults who are working. And so we have a current study We're in the feasibility trial right now, and the randomized control trial is about to begin. So we're excited about all of these directions that our research is going and our development is going. It's pretty exciting for us. Let me just check in, Kelsey, see if there are any questions so far, any thoughts that people have before I go into the foundations.
I'll just thank Michael for sharing that link in the chat. So that was one question that we were able to answer.
Thank you. Thanks, Michael. All right, so let me then get into what inspires us and what else informs HYPE. There are a lot of cornerstones to HYPE, a lot of undergirding of HYPE. And here's one we really are thoughtful about and pay attention to, a career theory called planned happenstance. And this is really about creating the opportunities for and then making use of unplanned events and opportunities into learning, right? And so offering people the opportunity to explore and try things out, to generate kind of new opportunities, and kind of skilling them up. That's probably not the right word, but helping young adults to enhance their skills so that they can take advantage of those opportunities. You know, one of the things that I think about a lot is, you know, how many of us thought we would be in the job that we're in now when we were 18. I know I never imagined I would be in psych rehab, that I'd be working as a training director in, you know, a mental health, you know, vocational kind of program. It just wasn't even part of my lexicon. I had no idea that this even existed. And I remember being in crisis at one point in my college career, very early on. Everything I thought I would love, I hated. And I did not know what to study next. And at the time, I was sort of reading all of the course offerings, and I got to the area of occupational therapy and rehab counseling. And my thought was, people study this? This is amazing. This is so cool. It kind of came out in bright lights. And I luckily had some folks around me who knew about these areas, and I could talk to them. And that value of curiosity, I guess I was embodying there, was really desperation. I needed to figure out what was next. But you know, we try to foster persistence, flexibility, risk-taking, which is often kind of scary for folks, to have people try things out, but we don't learn without trying things out, and we don't learn, you know, without success and failure. And so this is all part of what kind of inspires and holds HYPE up. If anybody has a story like that about how they got to where they are now, I feel like life is just full of twists and turns. And if we can take advantage of that, of those twists and turns, boy, you just never know where we're going to land. Another piece that really supports HYPE and is kind of underneath HYPE is that we really think a lot about the development of human capital. This was a new term for me, but it really is, you know, the kinds of things that go into our resume. So the kinds of things that we have to offer the world, that we have learned how to do, the certificates and the experiences that we have behind us. Before I worked with HYPE, I worked mostly with older adults who, and I shouldn't say older like elderly, but like folks older than 25 usually. And what I saw was a lot of folks who had lost months, years, decades of human capital, who were fighting to kind of get back into work and school, and really feeling lost about it, and really feeling the pressure and the challenge of trying to get back what they had lost, I joined HYPE because I wanted to help people to avoid that situation, and to help young adults from the outset not lose time like that. That was literally one of my thoughts when I was looking at joining HYPE. I was very excited about kind of coming in at the beginning and helping people to go, go, go. Don't stop if you can. Try to keep collecting experiences so that they can add up to something great. This human capital is usually gained through employment and education. These are the kinds of things that we want to help young adults to gain, and they have impacts on earnings and on labor participation in the future. So speaking of that, we also pay attention to the rate of return on education to someone's earnings. And this rate of return is the effect of each year of education on earnings. And wow, there's a 9% increase in earnings for every additional year of education that a young person gets, or that a person gets. So there's also a compounding effect here, that if young adults get that education early, that 9% increase will also have a compounded effect over time, right? The earlier they can start to earn more, the more earnings they will earn over their lifetime. So we think this is really important because so many young adults have their education and employment interrupted or delayed when diagnosed with a mental health condition, or kind of early on struggling with the kinds of symptoms and experiences that you all probably see every day. So this is super important to us. We also use the choose, get, keep, leave framework that really comes from psych rehab. This comes from Boston University. Those of you who are in Boston, and the psych rehab, the Center for Psych Rehab there. I spent many years there. I feel very well steeped in choose, get, keep, leave. It is essentially what I studied for my master's program. And Michelle also studied there in psych rehab. So we both have this kind of running through our veins, and a way to organize how we attend to young people. So helping them to consider and make decisions about what they want to do, where to study, where to work, making those decisions ahead of time through things like factors associated with change, and making a goal plan. And I'll talk about this a little bit later as well. Connecting them to work and school experiences so that they have support to get into the kinds of work and school activities that they want to be in. And then to do the work that we're often not trained to do, which is to help young people to stay there, to keep that job or educational experience for as long as they want it and need it. There isn't a whole lot of training out there for keeping, and this becomes a very, almost like the work begins at keeping, right? So how to help someone to stay there successfully becomes a really big part of what we do. Skill development, resource coordination, accommodations, and assistive technology are kind of the three prongs of that service. We really want to support people in all of these different elements of skills and supports. But knowing too that young adults should also leave these environments, that young adults, are not expected to, as my father's generation was, to stay in a job for 30, 40, 50 years. I remember going to my father and saying, I've been in my job for 15 years. And he said, well, you're just starting out. How are you going to make sure that you can stay? That is not the case anymore. And it wasn't the case for me either, but it is not the case now. And, young adults will learn a lot about what works for them and increase their earnings and increase their skills as they choose, get, keep, leave, and do it over and over again in educational and employment kinds of settings. So this is an important framework for us. So in summary, in some ways, this was our rationale for developing the HYPE model. That we know that the existing supported employment models achieved only moderate success, and I would say especially for young adults who were really struggling to get started. There weren't a lot of employment models for young adults. So we really wanted to, do our best by those young adults and support them around employment and education. One of the important things that we try to affect is that a lot of young adults with mental health conditions become reliant on, they get on SSI and become reliant on that. SSI is tricky for young adults. It's tricky for anyone, really. Less than 1% of people who are on the SSI rolls in any given year that leave due to work, which means that 99% of people stay on the rolls because they're not working. And that's all people, but that's horrifying to me as somebody who is a big believer in work and education and supporting people to be out there in the world and doing their thing and, contributing to the world and learning and having community like that. That's not where I want to see young adults sit. It is also, if I may say, kind of a poverty trap, that it is meant to keep people in poverty and doesn't help people come out of poverty. And one of the things that really guides us is that we want young adults to not be in poverty. And as Michelle says, to be able to go to the movies and buy snacks, right? We want young adults to have a sustainable wage and an adult wage, or at least be moving toward a wage that really supports an adult lifestyle. So another piece of this is that we realized early on is that employment and vocational rehab programs really emphasize employment over education. We recognize how important education is for young adults and really want to add that piece in because we know how important that is to cultivating human capital. And then finally, that going to work and going to school are age-appropriate roles and activities, right? It's what young people are doing. They are trying to figure out, who am I in the world? What do I do? What am I about? What does, adult life mean for me? And we really want to support young adults to be young adults in all the ways that they can be and want to be. But knowing too that there are unique challenges to that, and HYPE really aims to address those unique challenges. All right, so as we get into prevention of long-term disability, Kelsey, is there anything you want me to attend to? Anything that's coming up as questions?
Well, a couple just comments kind of reinforcing the things that you're sharing. One question we did get is if HYPE is being implemented in Connecticut, or even just where is HYPE being implemented?
So, in Connecticut, interesting. I'm in Connecticut too. So hello, Connecticut. Yes, in various ways, HYPE is being implemented. So right now we are in some research studies that I'm going to talk about in a little bit. So that's being implemented through those research studies. In Massachusetts, we have a course that's based on HYPE that's being implemented. In fact, I think they just wrapped up one of their sessions this morning. So I'll talk a little bit about that. And we are available for implementation. So, agencies that are interested, systems that are interested, yes, we are active and available if people are interested. So I'll tell you a little bit more about that. All right. Thank you for your interest in that. And Hi, Connecticut. I didn't realize we'd have some other folks from there. All right, so I really want to talk about the prevention of long-term disability in young adults with severe mental health conditions. And if you are sharing, and I'm sorry, I'm not looking at the chat because I can't do that and talk at the same time, really bad at it. But I appreciate your talking kind of with each other about similar kinds of things in your interest and concerns about this area. We feel very similarly. And, you know, I talked a minute ago about how HYPE really aims to prepare young adults for an adult lifestyle. And one of the things that's really important to us is that we prepare young adults for the primary labor market. So I'll describe the secondary and tertiary labor markets. The secondary labor market are the entry-level jobs that we all start out in, right? I had many when I was starting out, and they tend to have, you know, short tenures, right? They tend to be kind of short things that we do over the summer or do for a while until we realize it's just not tenable anymore. They tend to have low pay, no benefits associated, no flexibility or little flexibility. So if somebody has to be out because they're symptomatic or their, you know, crisis has come up or life comes up, there's typically little flexibility, right? Somebody might lose their job for not showing up, for not being able to call out, and no vacation time, no break. So there might not be those kinds of things. And tertiary labor markets, sort of the gig economy, some self-employment, definitely offer some flexibility, work when you want to, but don't offer the benefits of the primary labor market, which can offer higher pay, benefits which really support and protect people, the flexibility of being able to be out if they need to, using vacation time, using sick time, and have career mobility, right? So we really aim toward preparing young adults to participate in the primary labor market, knowing that we may all start out in the secondary or tertiary labor markets, and we may use those markets for different things, but that in the end, most young adults really want to kind of head for better paying job with benefits, all the things. We think of ourselves as not your typical supported employment service. And in part, that is because we focus on career development. So not specifically just on jobs and not specifically just on school. We focus on overall career development, understanding that young adults move from school to work to school to work, or might do both at the same time. I know when I was in college, I did both. And I, you know, did all kinds of little jobs just to get by, right? So we're supporting young adults to kind of gather those experiences, learn from them, pick experiences that really will help them get to where they want to go, and support them to keep as many of those as they want to keep. And to, you know, support higher education pursuits as early as possible. We in HYPE have a strong and early emphasis on education. And in fact, education may become the primary vocational pursuit as compared to rapid job pursuit, depending. We do not have an issue with education being the primary thing that we're looking at. It does not necessarily have to engage jobs, but we also want to support young adults to do both. Internships, summer jobs, all of the things that young adults are doing. I've said some of this in the last piece, but it is often a long process. Young adults are learning their way through education, and education is very challenging. We're going to be talking about that in a moment. It's very challenging. And so how do we support young adults through this longer process that can be very challenging and very different than being in work? But education is important because, and this is the Bureau of Labor Statistics name for it, because education pays. So I want to point this out. Education has an unbelievable effect, protective effect on people in the workforce in general. So this graph, it's a lot to look at, and there's lots of small words and things here. But to the left, you have the kinds of diplomas and degrees, and it's very college oriented. I'm going to apologize. The trade schools and things are not represented here. But that being said, it looks at the impact of education on weekly earnings and unemployment rates. So their most recent one that I found as of last Friday or something was from 2021. I will say that the graphs every year look almost exactly the same. And you'll notice that in the middle of the blue and in the middle of the green, there's a dotted line going up. On the left in the blue, this dotted line is the median usual weekly earnings for all workers. And this was looking at 25 and over. But those who had less than a high school diploma made a lot less, $600 a week ish in 2021. That number went up pretty significantly to about $800 if they had a high school diploma. And it kept going up as people started to get some college and associate's degree. The numbers only cross the median line and get really good at a bachelor's degree. And the more education that somebody has, the more earnings that they would have. So they kind of cross that threshold at a bachelor's degree. And now similarly, if we were together, I'd say, what do you notice about the one on the right in the green? That number is the employment rate for 2021, 4.7%. And if you notice, for folks with less than a high school diploma, the number of folks unemployed was almost double that rate. That's horrible, right? So it was with more education that people got close to that line. So some college and a high school diploma, they were more protected. But it was only after they started to have a degree in college that they became more protected than the general public in terms of unemployment. So what this says to me is that the more education one has, the more potential earnings they would have, and the more protected they are against unemployment. Similar in 2010, the report there looks very similar. The graph is slightly different, but you can see very similar themes. So this really doesn't change year to year. So I don't get very sad that 2022 wasn't available. So education is super important for young adults, and they experience barriers. Now, I had mentioned earlier that the numbers of folks who struggle in college with a severe mental health condition is very high. And this is the actual number. Young adult college students with a mental health condition have the highest rate of attrition of all college students. And that number is at 86%. The number of, or percentage of freshmen across the US who attrit, who drop out, is 24%, which is a major problem for colleges. They want to keep young adults or college students in college. No other group that I could ever think of would have an attrition rate of 86%. I think if it was any other group, there would be huge outcry. There would be demands for making sure that this doesn't happen. 86%. My mind gets boggled by this number. There are lots of issues that get in the way. But we are out to support young adults to stay in college, and we are having good effect so far. And I'm going to get into the research on that in a little bit. But you can see why we get very passionate about this. So our focus then is on maintaining young adult identity, including student and worker identity. We actively work against the development of a disability identity. So we haven't really talked about that here, except sort of to talk about the opposite. So one of the things that we aim to do through focusing on employment and education is that we really don't want people to over-identify with a mental health condition, to be like, hi, I'm Joe, I'm a schizophrenic. That is the worst thing I think I've ever heard somebody say, and I have heard people say that. We want to prevent that sort of over-identifying with a disability, with a mental health condition. Not to say that people shouldn't know about what affects them. We absolutely want to help folks to understand how their mental health condition affects them at work and school, but in service of participating in work and school so that they can really have and be able to create a student or worker identity, or both. Within that, we work to prevent the application to and enrollment in disability benefits whenever possible. That can be challenging to us because we often see that as a protective measure. But young adults can get health insurance and not be on SSI. Or SSDI, they can do that. And the problem that I have with SSI and SSDI, and I used to teach for many years, teach people, providers and people with mental health conditions, how to deal with the rules of Social Security and when it came to going back to work. You know, I forgot what I was going to say now. Kelsey, I forgot what I was going to say. That disability benefits is, well, a trap in some ways that I've talked about before in terms of poverty. Gosh, what was I going to say about that? Yeah, oh, I know what I was going to say. That young adults or anybody really who's applying for disability benefits has to say that they cannot work in any job in the US economy. That is absolutely opposite to what we are looking to help people to do. So, and they're often having to delay their participation in work and school while they're waiting for their application to go through, and they're, really, trying again and again and again to get the disability benefits. They are just languishing without building that human capital that is so important to career development. So with that, instead, we really work to develop the kinds of skills and the mindset that helps young adults to persist in school and work through highly specialized supports and executive functioning skill development. Okay, I just said a lot there. Kelsey, is there anything we want to attend to before I move on?
Nothing standing out now. I mean, I will also just kind of reiterate, as somebody else has said in the chat, this idea of the poverty trap and how really relevant that is to, I think, what a lot of us have seen.
Yeah. Yes, huge problem. We really don't want young adults to be in this situation where they can only have so much money. It makes it almost impossible to get housing. It makes it very difficult for people to go back to work. All of the disincentives involved with getting off of the rolls of Social Security benefits, they really are disincentives. There are lots of incentives that I used to teach people about, but it's hard to get information about that. And if we can help people just continue to have a career, to start their career and kind of continue gathering experiences so that they can have a satisfying career, that's really what we want for our young adults. All right, well, so I've talked a lot about what's important to us in HYPE. Let me talk a little bit about what we do in HYPE, because somebody had asked, where is this? And let me talk at least about what we do, and then I'll talk about where this is. I thought we should include something that looked like this. So let me talk a little bit through this. we help providers to learn both how to support education and employment. And the way they do that is by first perhaps looking at the factors associated with change. This is sort of a readiness assessment and development process that looks at motivation and commitment and support and awareness levels of young adults around how much do you know, how much do you want this thing, how much are you aware of what's out there, how strongly do you feel about moving forward. And there's a very well laid out assessment that's kind of a self-assessment. It's a guided, facilitated self-assessment where the young adult thinks through these pieces. And if they have low levels of motivation and commitment, then we would work very intentionally to develop those factors that are problematic for the person. If the person is like, listen, nobody else in my life thinks I can, and that immediately makes me wonder if I can, then we'll do very specific things like help the young adult to find out more about what's out there and try out pieces of the world of work and the world of education to really test out, well, can I or can I not? If they just haven't been exposed, we might expose them to different environments. So there's a very intentional development of that motivation, commitment, awareness. If they come in with moderate to high levels, we would go right into career exploration and goal determination. And the same after we've developed some of these factors. We would work with the young adult to choose, where is it that I want to go next? What do I want to do? And let's make a plan, a very specific plan that helps us to move in that direction. The plan guides everything that we do. And, some young adults might decide that they're primarily educationally oriented. Some want to go for work. Staff are trained cross education and employment so they can support both. And recognizing that folks in education might be trying out work, folks in employment might also do some school. And that process, as we could see through the Choose, Get, Keep, Leave foundation, that process kind of may continue over and over again, depending on what they're interested in trying out and doing. This is a very busy slide. I apologize, but I kind of like the idea of the sort of house being built for helping youth on the path to employment with foundations in psych rehab and supported employment and education. The emphasis on educational development, our methodological foci, how we approach young adults for long-lasting change by addressing these factors that around motivation, commitment, awareness that are super important. Helping the young adult to self-assess where they want to go, having a vision for the future, at least starting out, and then implementing the kinds of support and skill development strategies that a young adult needs, all the while engaging them in authentic relationships that support this process. So that's kind of us in a small snapshot. Here's another snapshot that when we were doing hype on campus, somebody was asking me, one of our providers was asking for a map, and I'm terrible at map making, but this was what I created. And I thought this is kind of a simplified map. We engage the person, we assess their needs, we start executive functioning training even as we're making a goal plan, and then we develop the kinds of skills, resources, and accommodations that are needed. I just mentioned the assessment of needs, and so we have various tools. So one of the things that I think about in a specified model like this, we have a lot of tools and training materials that we use to help providers to be able to do the things that we all believe should be done. But then the question is, how do you do it? So we have developed an entire repository of tools, guides, training materials, including, recorded presentations and live presentations that we do to help providers know how to do an assessment like factors associated with change, and to figure out, well, what kinds of skills, resources that you might need, even accommodations that you might need in relation to what you're struggling with now. That gets me very excited. We've actually been adding to our repository of late. So we're building an online course that'll be our master course for training in HYPE, and along with that, an entire repository of tools, including our goal planning process. So, we use SMART goals, but beyond the SMART goal, we really focus our planning around something called goal attainment scaling. And this is very popular in like PT and OT. And we have modified it for our own purposes to really give providers more of a way to help young adults to look at where they are now, where they want to be. If life was even better than that, where would that be? And then to track progress along the way, along those milestones. Along with goal planning is also service planning, which sounds like a goal plan, but it's actually the provider's plan for also additionally supporting the young adult's goals. So something like motivational interviewing might go in there. It's not something that the young adult's going to say that they want you to do, but you might be planning to do it. So there's additionally a service plan as well. We have lots of tools and guides around teaching skills, supporting skill use, executive functioning, which I'll talk about in a sec, resource coordination, and supporting the use of both academic and workplace accommodations. Oftentimes, there's just not a lot of information about that. So we train providers to really know how to support the use of accommodations in both kinds of settings. So let me talk a little bit about executive functioning, because this is super important to what we do. Part of HYPE is training providers to offer an intervention called Focus Skill and Strategy Training, or FAST. It used to be called FAST. Don't ask me what that stood for. I can't remember. But Focus Skill and Strategy Training is a manualized compensatory cognitive remediation intervention, which basically helps to compensate for the cognitive or thinking barriers that young adults might have. And that they need to address to be successful in work and school. This training, this curriculum is seen to reduce the impact of the impairment. So it actually helps to reduce the impairment that people experience in work and school settings, which is super cool, and enhances their performance. It makes them more successful in through doing real world cognitive tasks. So this is kind of a cool thing. I'm going to show you what that looks like in a sec. But this is a modification of an intervention that focused on employment. Beth Twomley is also an author on our FAST intervention that primarily focused on school, and now we're actually developing a work version of that. This was developed because of a study that Michelle Mullen and colleagues did in New Jersey. They expected to hear that what was getting in the way for young adults in education was psychiatric symptoms, primarily. And they said that, sure, over 50% of people said that managing psych symptoms actually was a big part of what they were struggling with. But they also said that they had difficulty memorizing information, studying, taking exams, preparing for class, writing papers, taking notes, researching information, and over 70% of respondents said concentration, time management, stamina, being able to keep going, organization, and prioritizing tasks were the biggest things that were in their way. So Michelle, I think, realized that, oh, this is not something that treatment is going to impact. We need a way of addressing these issues. And that's what FAST is about, because we know that without executive functioning support, especially in education, from our research so far, is that they cannot keep up with the constant demands of student life in college, that there is a prolonged cognitive overload. There's just too much that they're trying to hold on to in their heads and manage the competing demands of having 3, 4, 5 different professors, kind of like different bosses, asking for different things at the same time at different times. Hard to know what to do first, where to spend my time. It is a lot and it overwhelms people, and therefore they start to leave college or drop out or fail out. We basically see that ending in 2 ways, that either people hold on for dear life, they white knuckle it, just kind of forcing themselves through by sheer will and determination, perhaps with supports, until the end, and then crash. Or they crash and burn during the semester and end up taking incompletes, have poor grades, drop out of classes or out of school altogether. So without this executive functioning support, they really struggle. What we have created and adapted is what exists now. It gamified, exercise and discussion-based facilitated curriculum. This is not something you hand to somebody and just say, all right, do this and you should be fine. It's not a workbook. It is a facilitated curriculum that teaches the skills of time and task management. So like calendaring and to-do lists and prioritizing tasks, those kinds of things. Focus and attention, which is both conversational and task attention. So how to pay attention to what you're hearing in lectures, or what your boss is asking you to do, or just somebody, your roommate is asking you to do, and how to kind of maintain focus while you're trying to study or get a paper done, that kind of thing. Verbal learning and memory, so a lot of memory strategies, and learning strategies, including note-taking, how to take good notes, because I remember supporting college, well, not even college students, kind of trade school students who just didn't know what the most important information to write down was. So they're trying to write down every single word that the professor was saying, highlighting every word and every line in the book. And like, it's heartbreaking, right? How do you know? Who teaches people how to know what is the most important information to highlight? So we teach people to take really good notes. And then finally, problem solving and cognitive flexibilities for those who kind of think about, like, there's one way out of this, there's one way through this thing, to help them open up their thoughts and ideas. And we teach a 6-step problem solving method. And some people have said that was the most important part of the course for them. Surprising us a little bit. We sort of thought, well, at the end we'll also deal with this, but that ended up for some people being the most important part of this curriculum. Now, one important thing to know here is that it's not just what you do when facilitating the curriculum, but there are home exercises that are key to this. This curriculum is meant to not just introduce young adults to this, but to help young adults to form habits and skills. So they try it out on their own situation, in their own life, at home, and with support from their facilitator to really start to integrate and incorporate these skills into their lives so that they work for them. It's important to say that we have some recent research that is not yet published. We're giving you a sneak preview into what we have found. It is about to be published, that we found that FAST had a great impact on academic persistence, meaning helping people to stay in school and stay at it. The odds of persistence in school were significant. And in fact, the odds that participants would academically persist was 86%. Blowing our friend Michelle Mullen's mind. It had a very large estimated effect on academic persistence and on what is it? I'm going to have to come back to that point because I forget. But the belief that I can, what's that called? the belief that
Self-efficacy.
Self-efficacy,
Mm.
thank you, had a huge effect on self-efficacy. So to me, that tells the story of, you know, the students who take part in this, one, take the skills, use it to stay in school, and feel empowered by it. And we found that from the earlier studies too, that people who took this, who went through this curriculum, actually kept using the skills, which is really exciting for us. Okay.
We did get a great question, I'll point
Yeah.
out. I think especially on this topic of, you know, executive functioning, but about, can you speak to how to support youth who have low motivation, particularly due to substance use? And this person specifically asking about cannabis. So is that something that you guys have looked at either in the data or are addressing through the materials?
Yeah. You know, we don't have a specific focus on substance use. I can't say like, if the person is using substances, do this. So I wouldn't say that, but you know, it's very, very common. You know, I don't expect to see any group of young adults where there isn't use of substances, especially cannabis. So, you know, I think that, you know, one of the skills that we anticipate that people use in conjunction with HYPE is things like motivational interviewing, where we're helping young adults to think about, well, what is it that you want? And helping people to affect change in their lives in terms of like, what kind of life do I want? And that is our focus, I think, here, is helping introduce people to the possibilities, and you know, making it very real and helping people to see what their possibilities are and what their capacities are. So that's how I think about it. But I'm happy to chat with anybody who's interested in talking about that more. Thank you for bringing that question. So somebody was asking if, you know, where is this being offered? There are a couple of spin-offs, kind of, as I call it, of HYPE. One of them is the HYPE course. We've been operating this primarily through the Department of Mental Health in Massachusetts. We appreciate their support of this. It started as an in-person long 12-week long course that used to run for 3 hours. It included lunch, lunch and chocolate. But when COVID hit, we were really pushed to change our course. We realized that people could not survive being online with us for 3 hours. And so we divided this course into 3 courses. The visual here talks about school prep. It is a virtual or in-person series of courses that are 6 to 7 weeks long, an hour and a half a week per course, per session, I should say. And it's kind of designed like a topical seminar. So different topics to help young adults prepare for career decision-making, getting into work and school. And in addition to the course sessions, people are supported in individual sessions to kind of follow up on what they're learning in class, take it further, take it really into their lives, operationalize it. So here are those courses. The HYPE Career Decisions course, HYPE School Prep, and HYPE Work Prep are the 3 courses. HYPE Work Prep is 7 weeks. The other 2 are 6. And they all have some level of career decision-making in them. Just in case somebody just wants the one course, they might take a career assessment in work prep or school prep, but with an eye toward those vocational environments. Career decisions really focuses primarily on helping people to think through, where is it that I want my career to go? What is it that I'm interested in doing in my life, at least from where I stand right now? And then HYPE school prep and work prep really focus on choosing, getting, and keeping either school or work. Some of the topics that you might see in these courses are like a career assessment. We use the SDS, or sites can use My Next Move or a similar one through ONET, conducting career research, including through informational interviews. People get tools and really think through how to prepare themselves for things like an informational interview. A lot of people have never even thought about talking to somebody in that way about what they do. In school prep, there are 6 different topics, 2 of which are choosing a school program or area of study. And the most popular session is actually on disability services and academic accommodations, just because there's not a lot of information out there. So people have a lot of questions and get very engaged in that one. In work prep, you might see out of the 7 sessions, focus on like your network and how to talk to them through an elevator pitch, creating a work plan. A plan is created in each class for how do I want to achieve this thing in my life, either headed toward a career, school, or work. So that's kind of a fun one. This morning, a group, several groups in Massachusetts, the Young Adult Access Centers in Massachusetts have been learning their way through the HYPE course, and they just finished sessions 1 and 2 of school prep as they work to offer these courses in their centers. And here's some more kind of new stuff coming our way. As I mentioned, we're doing a study, a randomized controlled trial of FAST, our executive functioning curriculum for workers. And so we just developed a work adaptation of that. We also now have FAST on a digital platform, so more engaging for young adults, and you're able to use it with folks that you're not sitting right next to. So you can be doing that through, Zoom or whatever, to teach people those skills. So that's pretty cool. We're in beta test now of digital FAST. We're looking toward offering FAST and HYPE for marginal populations, foster care, etc. So that we see as kind of a new direction for us. And as I said, we're building this repository of tools, kind of refining our repository of tools so that we can do training and technical assistance with systems, agencies, etc. that want them. We are about to start working with an insurance company that helps provide services across one large state. And so we're about to work with agencies all across that state to implement HYPE. Here's something that's free and available. I thought I'd put that in there, that there is a course called Engaging Young Adults in Work and School, part of the Success at Work and School series, on our website, hypecareers.org. This is our kind of training portal, and that is free and publicly available. We have another course coming up soon that will be work and school resources for young adults that providers and families can share with young adults that have to do with work and school to support them. And I guess I'm open to questions, comments. I was trying to keep this to an hour, but I think I went into the hour and 15 minutes area, but I'm happy to take any and all questions. And I'll put put our email here so that you can email if you have additional questions after, or if we don't have time to get to yours.
Great, thank you. And yes, please feel free to put questions in the chat. First one, just for me, do you have the dates for that upcoming session?
Sorry, which upcoming session?
Sorry, you said you had an online course, and then coming soon there was another one.
Yes, so I hope that it will be up by the fall. So that's this course here, the work and school resources. Yeah. By the fall, I hope to have that up and running. Yeah.
Great.
Yeah.
And then another question I've gotten, just how to enroll a young adult in these kinds of courses.
Yeah, so that's a really good question. We are a research and training center by, like I was going to say by trade, but by what we do. We don't currently just offer these services out of our own place. We train others to provide these services. So we have a model, we've been testing it, we train people to it. And so there are places where people are starting to offer it. For example, the Young Adult Access Centers are starting to offer the HYPE course. As they've been learning their way through, we've trained other organizations who use the materials in that course in different ways. For example, there's a group in Roxbury in the Boston area who were trained in the HYPE course last year, who are now using it for their summer programs and in their other employment-related programming. And some of their folks are now training with us, training other folks. So I hear your question, like, where can we access this? And I don't have an easy answer for that, but what we do best is train folks to offer it. So I would say that if you are interested in having your family member participate in something like this, and this kind of service is not offered where you are, to talk to us, but also do some advocacy around, hey, we need services like this. They're not easy to come by. I feel people on this. I get questions all the time, like, where do I find supported employment? Where do I find this? And it's not easy to find in some ways, but so crucial to young adult development. So we're happy to help with that.
Great. And another question, somewhat related to that. So a lot of our teams are using, or in Massachusetts, the IPS model is what folks are primarily trained in. And so I know that includes a lot of, community work. So can you speak to kind of how much that is also a part of HYPE or not so?
Yeah, it's interesting. It's part of I didn't talk about our principles that guide us, but if you go to HYPE's website here at UMass Med, you'll see them laid out, the principles that guide us and our values. And, big part of that is getting to, helping young adults get out into jobs quickly. Very similar values and principles to IPS. We're very much informed by supported employment and supported education. So, our thoughts about that are very similar. Helping people to get into a job search quickly and not having to, or not asking young adults to wait and to go through a series of other things before they get out into jobs and get out into school. It's very important to us. Working with the community, with employers, with educators, with, disability services, with all of the things, coordinating those resources and supporting young adult access to these environments, absolutely key. Absolutely key. Yeah, thank you for that question. I appreciate it.
And then we have another question, just if the slides will be sent out too. I think we saw beforehand, those will go on the website along with the recording. But Lola Brickell, let me know if that is not right.
Mm-hmm.
Yep, they'll be sent out to all participants once they get posted on the website.
Fantastic. Yeah, and I just want to say, I very much welcome any other questions or comments, or somebody wants to chat. I love chatting with folks about possibilities, questions that come up. So don't hesitate to reach out. This hype@umassmed.edu email will come to me in most cases, unless it's for somebody else and for something else. So I will see your email. It's just easier to spell HYPE than my last name, just saying. So that'll come to me. And you can also go to our website for more information. You can also go to hypecareers.org to see like what we're doing with other agencies, what other systems in the different ways that we train folks through Hype on Campus, through Hype training for organizations, the Hype course facilitator training. You know, we're really interested in preparing program systems, providers, people to be able to support the effort of young adults to get into work and school for career development. So let us know how we can be helpful to you.
Yeah, thank you so much. I'll leave it open for maybe one more question if anybody has anything.
Just a quick note beforehand, I just posted a link to our post-event survey in the chat, and I'll also be sending it out via email after this event. So if you could all please fill that out, that would be great. Thank you.
Great.
I can see that somebody asked, is the curriculum available to us? And that's a really interesting question. I think you're asking about the executive functioning curriculum, and it's not just publicly available, but because we strongly feel that people need to know how to kind of facilitate that curriculum and teach those skills. So we provide training. We are hoping that within the next year or so, we might be able to offer a FAST institute through which individuals or groups of providers, etc., can learn how to facilitate that curriculum. And of course, they get that curriculum as part of that training. So thank you for that question. I was just popping into the chat here. Oh, and somebody's saying, love to connect with me. Please email me. I'd love to connect with you in Connecticut. That would be great. Yeah, I regret not studying OT in school. I appreciate you. All right. Well, thank you. I will say this. Thank you so much for having me and allowing me to chat about Hype. I feel like I could talk about Hype all day. So thank you so much for having me and allowing me this forum.
Yeah, thank you as well. Really, really informative. And thanks everybody for stopping in on a Friday. Have a great rest of your day and a good, hopefully long weekend for most folks.
Bye, everyone. Thank you.